So hi everyone, just following on from Tom's last video, we're going to talk a little bit now about how we would send off a urine sample to the lab, and you might want to do that for a few reasons. One, that you've had a positive urine dip, and two, you just want to make sure that there's nothing growing in that urine, and also what any bacteria in there might be sensitive to, so they can let you know if it's sensitive to trimethoprim, etc. And you're going to need to send that off to do so. There are a few sample pots on the ward, so just want to make sure you get the right one. So the white one is just a general sterile pot. People put things like chest drain samples and things like that in there. Then you have your blue top one, and that's got a little spoon for your stool. It just goes in there. But the one that you'll need is an MSU pot, midstream urine pot. Red lid, but also it's got some powder in it, some boric acid, which is a preservative. I think you've got about 6 to 12 hours to get that to the lab and get it sort of analysed. And like I say, it's called midstream urine because what we really want is the middle bit of that stream of urine. We don't want that first bit. We want to get the patient to direct that into the toilet because that carries quite a lot of bugs in it. We want that middle portion that's sat in the bladder, and the end portion, again, that can just go into the toilet. So this is the pot here. It's got a little fill line, and just explain to the patient they're going to need to catch that midstream of the urine. If a patient's finding that difficult, which is actually more common than not, there is sterile containers on the ward, and they're normally covered in plastic, so you just open it up for the patient, just keeping that sterile. And then again, they can direct the first bit of their urine stream into the toilet, the second bit into the sterile pot, and any remaining bits can go into the toilet. And then you need to take the lid off, pour it into the specimen container, and then send that off to the lab. And as with any sample that we take from a patient, just make sure it's the correct patient, that it's labelled correctly, make sure the lid's screwed on, those kinds of things. Now, if your patient has a catheter, you're going to have to get a sample in a little bit of a different way, so I'll explain that. You can't just take it from the catheter bag. They can stay on for about 7 days. The bottom just sometimes hangs around, touching the floor. They're not sterile. So what you're going to need to do is take a sample from a port, which I'll show you where that is. So imagine this is the bladder, the very small urethra here, and this is what will be coming out the patient. And if you look where the catheter, where it comes out the patient, where your catheter bag is, there's a little port. It might be red, green, yellow, whatever colour, but you can see it there. And you're going to need to collect your urine sample from in there. Quite easy if you've got lots and lots of urine here, which you can just about see there. But if you haven't, you might need to clamp off the catheter, collect a bit of urine in there, and then take the sample out. But it's really important that if you clamp off the catheter, that you do release it, because if not, it can cause the patient to go into renal failure. The urine backs up into the kidneys, your urine output will obviously tail off, and it won't be very comfortable for the patient. So always unclamp it. And how you take that sample is you need a 2% chlorhexidine wipe, 2%, nothing else. A syringe, doesn't need a needle, and obviously a pair of gloves and an apron. Okay. So get that port, give it a clean. Because they can be really dirty as well, if you think about where that's sat with the patient. Let it dry. Again, just remembering your key parts of a syringe. Pop it in there. It just pops in, and then just draw back. And you can see the urine's in there. Take about 10 mils, I think, that should be enough. And then just take it out. Have a little bit of gauze just to give it a wipe. Unclamp if you've needed to clamp. And pop it into your pot like that. If you need any more, you're just going to have to go in again. And like with any sample, like we've said, make sure it is the right patient, that you've labelled it correctly, and you send that off to the lab, and hopefully your lid is screwed on, but I'm not sure about this one. Thank you very much.